How we will diagnose the GBS, Guillain-Barré syndrome? In the acute inflammatory demyelinating polyneuropathy, in the acute inflammatory demyelinating polyneuropathy, in cases of the acute inflammatory demyelinating polyneuropathy due to GBS, there is pattern of rapidly evolving paralysis. Rapidly evolving paralysis. Paralysis will be rapidly evolving paralysis. But the reflex are not present. Areflexia is feature. Areflexia. There is areflexia and rapidly evolving paralysis. But no fever in the acute inflammatory demyelinating polyneuropathy, and no systemic illness. Now we describe the steps in the diagnosis of the Guillain-Barré syndrome, GBS. First step is the bilateral flaccid weakness of the limbs occur. The first steps in the diagnosis of the GBS is bilateral flaccid weakness of limbs occur. Bilateral. There is bilateral flaccid weakness of limbs. Flaccid weakness of limbs occur. The weakness of limbs occur, but this is bilateral and flaccid in the diagnosis of the Guillain-Barré syndrome. Number second step we look for the diagnosis is decrease the deep tendon reflex. Decrease of the deep tendon reflex. Decrease the deep tendon reflex, and there is bilateral flaccid weakness of the limbs. In decrease of deep tendon reflex, that is areflexia. Areflexia without gait disturbance. The electrophysiological evidence may be present. The electrophysiological evidence may be present. And number 4 step is elevation of CSF protein. The elevation of CSF protein. When elevated the CSF protein without pleocytosis, it includes the diagnosis of GBS. This 4th step for the GBS. Number 1 is the bilateral flaccid weakness of the limbs. Deep tendon reflex decreases areflexia without gait disturbances. Electrophysiological evidence may be present, and elevation of CSF protein without pleocytosis. CSF protein may be 1 to 10 gram